Depending on the severity, if I think someone is just snoring mildly, what I do is I have an airway protocol sheet that I go over with every patient. It discusses putting an app on their phone called Snore Lamp, so I could at least listen to really how they're sleeping. The other thing it talks about is using nasal plugs to kind of open up their nostrils. So I think most people are mouth breathers, and we really need to convert the patients to being nasal breathers. And on the airway protocol form we give out, we discuss tongue posture. We discuss keeping their lips sealed and more breathing through their nose.